Hey everybody, Dr. Ed Gigliotti here. Upper cervical chiropractic care, low back pain. How are they related? That's a question we get quite often when people first start care with low back pain. We get a ton of referrals here from medical doctors, different health professionals, and a ton of friends and family who are trying to get their loved ones in here saying, get checked. This could really help you because I know you've been struggling for a long time with low back pain. Now, if you've gone through this before, you know how dramatic it could be affecting every facet of your life. 31 million Americans suffer with low back pain at any given time on average, and it's the number one cause of disability. So this is no small topic. This is affecting so many people we love and we care for, if not ourselves, at some point throughout life. 80% of people get low back pain throughout their life too. Have at least one significant episode, if not more. Okay? So to be able to answer this question, we have to look at the anatomy. If I could break down the anatomy, I think it'll make a ton of sense to you on how and why this is so important to assess. Okay? So a lot of times when we're looking at a low back injury, we're looking at it strictly where the symptoms are. And understandably so if we're going through it. If our pain is all right here in our lower back, right? You say, well, we got to solve this. Let's just focus strictly on those symptoms. But our body is one global system. Right from the top of our head down to the tips of our toes. That's one system. So a lot of times where the pain is not necessarily where the cause is. Okay? Let me dive into that further. One thing that affects low back function or dysfunction and creates injury can be posture. Now there's posture you can think about where you're like sitting up straight and making sure you're not slouching and like looking at a phone or on your computer down here the whole time. But there also is posture that's more involuntary. And that's those people that you see, your friends and family member who you notice they always tilt their head to the left when taking a picture, or they're walking in Wegmans with one shoulder really high. Okay? That's the posture we're going to talk about today. Okay? That posture is all your involuntary muscle groups. That the ones that just do what they need to while you're moving to stabilize you. One very important part of the central nervous system that you should look at when you're thinking of posture is the reticular formation. The reticular formation is in the brainstem. What the reticular formation is where all the nerves cross over. So for instance, it is right here. Okay? That stalk would be right here. So near the uppermost part of your neck. Okay? And the right side of your brain controls the left side of your body. The left side of your brain controls the right side of your body. We're talking so many nerve fibers. It's unbelievable. Crossover at this level. Control your whole life. But one important function of the reticular formation is controlling tone, balance, and posture throughout the muscles of your body. Tone, balance, posture. So if there's ever an injury in the upper cervical spine from a slip, a fall, a car accident, even decades earlier, before the first onset of symptoms of low back pain, right? Instantaneously from the point of that injury, if there's any vertebrae that are torqued out of position in that upper neck, putting traction on that tissue, okay, is a postural change will occur. All right, I'm going to zoom in here. If these muscles start firing improperly down someone's spine, if they notice it or not, and it might not be as dramatic as this, but you'll start to have postural distortions where you'll have one shoulder pull higher, you'll have muscles firing improperly down the spine where they'll pull a hip up, and in essence what will happen is a leg will pull short. We test for this in the office every single visit, okay, to see if there's pressure on this area up here. Now, when that happens, if you're stepping improperly, you're walking improperly, your spine's moving improperly over the course of years, months, decades, think about how much pressure there would be on these discs. Those are the cushions in between the vertebrae, and the nerve roots that supply all the sensory and motor nerves, so all the nerves that tell you how you feel and then also control the low back. Not to mention all the organ systems and cells and tissues that come off those nerve roots also, right? This would be somebody that does not have an upper cervical injury and there's no pressure on that nervous system where the posture is being affected. And this is someone that does. If someone's walking like this on the person on the left, over the course of years, months, and decades, like I already alluded to, how much more predisposition to injury? So we're talking like disc bulges and herniations, nerve compression, nerve roots, arthritis, needing hip and knee replacements. How much more likely do you think that would be on the left person than the right? How many more repairs would your vehicle need if you had 3 18-inch rims and wheels, and you had a 16-inch on the back right, but 18-inch everywhere else. Think about how the mechanical stress that would occur from just driving alone on the tires and everything, the suspension, the frame, everything. Okay? It's a similar idea. So that's why assessing the upper cervical spine is so important. That doesn't mean that we ignore the rest of the body, right? There could be secondary injuries down here, which will be addressed and cleared if they're showing pressure. But if you don't get pressure up here where that reticular formation is, and you were to just try and focus here while this malpositioning of posture is occurring constantly, do you think you could ever truly get to the root cause and get those tissues healing, get the nerves regenerating, and get pressure off that delicate system so it could start functioning the way you're designed, which is closer to here? Probably not, right? So that's why it's so important that we focus on the spine as a whole and we understand the anatomy to start getting that pressure off so people could live the way they're designed to. Okay? Now, one more thing I want to focus on here. A lot of times the pain is what really we focus on. And understandably, if you've ever struggled from low back pain, and I did for a portion of my life before upper cervical chiropractic care over a decade ago, but if anybody ever has, you realize how significant and how debilitating low back pain is. It's like when you're going through it, you're like, I just want anything to get rid of this. I can't live like this. One aspect that we don't usually think about is those same nerves that control all the sensory nerves, that control all the sensory throughout our body, control all the motor nerves of all of our organs. So it's like you want to look at the lower half of the body alone, right? Like you're looking at T11 here, and T11 controls so many of your hormones here. You got L1 and L2 that controls your bladder function and your sexual reproductive organs. You have intestines and digestion controlled off of these levels also. Like there's so much more. So it's like if we were to focus strictly off of trying to reduce symptoms as opposed to getting to the root cause, how do you think our health could or would be affected 5, 10, 15, 20 years down the road by just trying to numb down nerves, burn nerves, medicate them away, while not at the same point trying to find out what's truly happening causing all this? Okay? So much more. Okay? If this resonates with you, share the message. If you're struggling, let's see if we can help, or find an upper cervical chiropractor in your area, or a chiropractor in your area that can help maybe assess to see if there's pressure on your nerves that could help transform your future. Okay? Because sometimes very gentle and specific adjusting can have such profound effects in your life. It's mind-blowing. It could literally change the whole trajectory of your future with your friends, your family, your career, because it's affecting your health. Okay? Love and appreciate you guys. Please, if this resonates with you, share this message. Number one cause of disability is low back pain, and there is an answer through it. You just look online on how people have been helped with upper cervical chiropractic care and low back pain. It's mind-blowing. Thank you.